Sciatica is one of the most common reasons people come into our office and seek chiropractic care. I want to just teach you a little bit about what it is and how it occurs and what we do specifically to help correct it. If you look at the bottom bone in the spine, it's called the sacrum bone. Position of this sacrum bone can cause stress all the way up the lumbar spine. The sciatic nerve is the largest and longest nerve in the body, and that nerve encompasses branches of the sacrum and branches off the lumbar spine. So through specific chiropractic care, our goal is to realign the spine and physically take pressure off of the nerve root, and that results in an improvement in sciatic nerve pain. A recent study of chiropractic care associated with sciatic nerve pain showed a functional improvement of 70% and a pain reduction of 60% within the first 4 weeks of specific chiropractic care. Patients overall stated that they felt more satisfied and were provided better explanations about their pain and their symptoms from chiropractic doctors over traditional routes. So I encourage you, if you have sciatica or you've had it, or you have a family member or a friend that does, do some research and allow us to at least do an analysis of your spine and show you where the nerve interference is and what could be contributing to it, and allow us to come through recommendations on exactly what we can do to help you.